Have you heard any of these terms? PSA velocity, doubling time, density? Or perhaps you heard your urologist mention free to total PSA, supersensitive PSA, or a PCA3 test. Let's start with the first metric, PSA velocity. This measures how quickly PSA levels rise each year. A fast rise, greater than 0.6 to 0.75 nanogram per milliliter per year, can signal a higher risk of prostate cancer. To calculate the PSA velocity accurately, at least 3 PSA tests over time are needed. The second metric is PSA doubling time. PSA doubling time tracks how long it takes for PSA levels to double and can be helpful in monitoring known cases of prostate cancer. A fast doubling time, for example less than 4.3 months, may indicate that prostate cancer has spread. A slower doubling time, for example more than 11.7 months, might suggest that the cancer is localized and easier to treat. The third metric is PSA density. PSA density looks at PSA levels relative to the size of the prostate. Higher density, for example, greater than 0.15 nanogram per milliliter of prostate tissue, is more likely linked to cancer. The fourth metric is free to total PSA. Free to total PSA compares free PSA, which is a PSA not attached to proteins, to the total PSA. A higher percentage of free PSA, greater than 20 to 25%, usually means the prostate is not cancerous. The fifth metric is supersensitive PSA. Supersensitive PSA detects tiny amounts of PSA after prostate surgery, which signals any cancer return as early as possible. If the levels stay very low, less than 0.01 nanogram per milliliters, it means that the cancer is unlikely to return. The sixth and the final metric is PSA3 test or prostate cancer gene test. This test measures a prostate cancer-specific gene in the urine after a prostate massage. It's used when the PSA is high, but a biopsy didn't find cancer. The test is fairly accurate in ruling out cancer with reported specificity of 70%. This is the end of the video. I hope you found it educational, and you now know what these tests mean and how they're used in detecting or monitoring prostate cancer. If you liked the video, please consider liking, sharing, and subscribing to the channel to help its growth.